Hello, welcome YouTube, and welcome to our segment of Bryant interviews. Today, I have a very special guest, Kristian Romero, Senior Marketing Manager at VirtualHealth. Welcome to the show. How are you doing today?
Pretty good. Thank you for having me. How about you?
So, um, very, very important because that's quite a mouthful there. So, virtual health, healthcare, marketing manager, it's like you do it all. So let's try to break things down a bit. What is virtual health?
So it's a B2B SaaS company at the very, very high level. It is a company that produces something called care management software, which is basically how health insurance plans keep track of their members, specifically their members that are in the most need.
Okay, so basically, when I went to your website, virtualhealth.com,
Yep.
the first thing you see is delivering the future of healthcare.
Yeah.
Now, one of the things that interests me in this is that when guys like me or people like me think of healthcare, we think just the doctor, the nurse, and the surgeon. We don't automatically, it doesn't sink to our mind that it's much broader than that. So how do you fit in this broader scheme of things in terms of healthcare?
Yeah, sure. It's a great question. So, uh, I guess I also hesitate to answer this immediately because I always have to gather my thoughts on it. So depending on the audience, I'm going to answer this a little differently. I know this is more of a generalized audience. So my thinking here is you have your providers, right? Those are your typical doctors. Those are your nurses, your typical healthcare providers, right? We call those the general bucket providers. Then we have what's called the payers. These are the people who literally are in charge of paying your bills, right? So they're your healthcare bills. And we say that they pay your bills. Obviously, you pay your own health insurance and stuff, but these are the guys who are sending the actual paychecks to the doctors more often than not. There's a whole bunch of situations where you might pay a doctor directly, sure, but we're talking in general, right? So these are the payers. And so what we do at Virtual Health is we provide software to these payers, to these people who work alongside and with the providers.
So that's actually interesting because technology, you know, the technology difference between now and 200 years ago, right? Using a more extreme example, is
Mhm.
night and day, one would assume, right? You go to the doctor now, things are digital, and looking down what you've done, you're the marketing manager. So how do you bring to the audience or communicate to them, this is important, this matters, this is a part of healthcare, and and this is what it is?
So that's a difficult one, right? Because we have to kind of talk to multiple different audiences. We kind of have to talk to, at one level, we have to talk to who the members are, right? We have to talk to the people who are actually on these Medicaid plans, these people who are on the Medicare Advantage plans. We have to explain to them what kind of services their health plan might be offering them that they might not even know about. Health plans don't always do the best job of kind of informing their members, especially their members who are more healthy, which is why you might not even think of your health insurance plan having services that you could benefit from other than just paying bills. They don't really do too good of a job, in my opinion, of marketing and kind of telling people what's available to them. And their health insurance companies do a lot for people. They're kind of like the end all place where all your data for healthcare kind of winds up, right? Because when you go to a doctor, they have to enter in what they saw, what they treated, what they did with you. That information ends up in quote unquote what's called claims data, which is essentially what the doctor is asking for payment for. Almost like if the doctor was invoicing them, right? So you kind of get a lot of that. And so what winds up happening is I have to be able to speak to, from the perspective of the member, right, that person who is part of the health insurance company and who pays their monthly premiums or whatever, or in the case of Medicaid, they receive their benefits. Then I also have to kind of speak from the perspective of, or to the perspective of the providers. So these are the groups of doctors. These are the groups of people who we really got to get in there and show them, hey, you should be partnering with these health insurance companies. You should be talking to them and kind of getting to know them a little bit better, kind of being able to be more of an ally, more of a partner with them so that you can, one, provide better care for your patients, two, get in touch with them and have that relationship established. So you might be able to leverage better payment structures, create better situations for just everyone involved. And then we also need to speak with the health insurance companies directly, because right, we're selling to them directly. Our software is, at the end of the day, they're giving us money for our software. So I need to be able to communicate to them, why is the software so useful? How does it connect all of these different kinds of people, all of these different kinds of groups? And how does it bring all of that data in, right? And then there's the side piece, right, that health insurance companies have recently, and I say recently, but this is in the healthcare industry, which is recent as the last 10 years, right? They move a little slowly when it comes to technology. It's, it is what it is. So in the recent years, in the industry at least, they have been considering what's called social determinants of health. Now, this is a buzzword. These are a series of buzzwords, rather.
Never heard of that. So you're going to have to elaborate.
Yeah, no problem. So anyone in the industry has heard of this, and they're going to roll their eyes and be like, oh God, he's talking about SDOH, social determinants of health, super important. And basically what this is when you think about it, 80% of a person's health has nothing to do with their actual diagnosis. It has nothing to do with what they go into the doctor for.
That's actually
80% of their health has to do with, do they have enough to eat? Do they have a roof over their head? Do they have access to get their medications at a normal weight, or maybe they're disabled and they can't actually make it to the store. So all they can depend on is food delivery, and what's around them, maybe it's fast food only. So their diet consists of fast food. Why? Not because they're choosing to be unhealthy, but because they live in a food desert. Maybe they live 40 miles from the nearest store. Who knows?
That's actually interesting, because with the advent of technology and how everything's moved, nowadays people can get deliveries of their prescriptions. People get Amazon. People get Amazon Fresh. Why do you choose to be in the technology aspect of healthcare?
Yeah, I think that as much as we can move healthcare forward, as much as there's new research, there's new drugs, there's new everything, right? Procedures and everything in healthcare. I think part of the challenge is making a gigantic impact and really shaking up the industry. When you have a new drug, when you have a new technique, a new surgical technique, when you have a new treatment, you're impacting overall, right? You're impacting a lot of people's lives. But at the end of the day, you're impacting a very small segment of all patients, right? When you introduce a technology solution, you're giving all of the companies involved, right? You're giving them all the option and the ability to have a much bigger impact. They're not just looking at their specific members or their specific patients that have diabetes or that have congestive heart failure. Now they're looking at patients who need the most help, right? That becomes a much broader category, becomes a much different conversation than patient with X disease.
That's actually very interesting, actually, that you bring that up, because when don't mean to cut you off, to go back to the previous point, about 80% of people's health not being the diagnosis, and people not eating healthy and so on and so forth. And if someone doesn't exercise, sedentary, and stop me if I'm immediately wrong, eats nothing but sugar or a lot of smoking, then that's going to affect their health and give them a reason to go to the doctor. Am I mistaken?
No, you're absolutely right.
So how does virtual health and data, do you have a database where you have a general idea of, if you do X, Y, and Z thing bad, you are more likely to have X, Y, and Z problems? And does that help people to know those correlations, or?
So we don't get into the granularity of the individual little things that contribute, that cause you to be 20% more likely to get diabetes or this and that.
Okay.
Our focus is, and the reason we don't do that in particular piece is because there's already a lot of great, really intelligent researchers who are focusing that one relationship, right? And so all of these different kinds of studies are happening. All of these different kinds of doctors are doing all these different things, and they're all producing their own databases of information. They're all producing their own, studies and findings and publishing everything. But the problem is, you put it out into a health journal, right? You put it out into this big major publication. there's no way that that necessarily translates into the programs that doctors are using, right? Maybe they don't subscribe to that magazine. How will they know that new thing came out unless it hits the media big? How many new health discoveries do you hear about on a daily basis on the media? Not many, maybe one or two
Right.
daily basis, maybe zero actually. It's more often like once a month you hear something major. And that's because the media has a lot of stuff to cover, right? They can only cover healthcare so many times in a month.
Right.
So what you wind up happening is you need to get information to doctors. You need to help them, get them the most up-to-date kind of like decision-making skills and decision-making abilities. But it's not necessarily something that, and also it's just a massive quantity of information, right? Like we're talking about these granular decision-making skills that have to come in that are based on research that's happening. So all of these things create standards, create all these things, and we integrate with each one of all those standards, all those little things. And they all come into our platform so that health plans, they already know a lot of these exist. They may already pay for multiple services, but if they're told their partner doctors and they told their care managers and stuff, oh yeah, you have to look up what the best choice is for each and every single patient you get and each and every single member you get, every single like disease, you have to research it.
That's
one member would take like days to do anything with one patient, one member. It would be impossible. You would be losing so much time. And honestly, people would be dying from that because you need to be able to make decisions a little bit quicker, right? Even if you're just talking about claims data, even if you're just talking about people getting their basic procedures done, right? Like they go for a physical. Well, who do you remind to go get a physical? Do you remind the person who's a marathon runner who, they're in their 20s, they're in their peak of their health? Do you have to constantly remind them to go to the doctor or to get checkups or something? Or do you remind the person who has historically been bad about going and getting their yearly physical? And maybe they have some other conditions that you also want them to get checked out. If you make an impact in that person's life and you know to prioritize that person, right? You have the ability to really, really make a big, big change. And hey, an email reminder doesn't take a company much. It's automated, right? But that person receiving it, that they've now been prioritized to receive that notification, to receive that kind of information, they're more likely to go see a doctor. They're more likely to take care of themselves. And then their health outcomes, the probability of them doing well in life and living a longer life and a healthier life increases. And all that comes from the little tiny bits of data and studies and optimizations that all these wonderful doctors and all these wonderful scientists are doing on a daily basis. All of that feeds into our platform, and our platform kind of brings that one place so that a care manager types in, hey, this person's 40-year-old, is diabetic, is a smoker, and then boom, it gives them a recommendation. When was the last time they had a physical? And they fill in that information because they just spoke to them. And now they're like, oh, but maybe they need to go see their nephrologist. Maybe it's time to go see their kidney specialist, right? Who knows? Well, we don't know, obviously. Like I'm not a doctor, I'm not a scientist, but people have figured out that there's a good timing associated with these things. These decisions, these information exists. The problem is getting it to the right people in order to help them make the decisions they need to help the patients.
That's actually a very interesting point because like even if you're not a doctor, you're still involved in the technology aspect of it. And it's that speed is very important in healthcare. Like if you, like, to use an extraordinary example, if you see someone that just, bleeding out the leg in an ER, you're not going to wait 10 days to treat them. They might be dead before then. Or a lesser example of, if you see someone with cancer that's just starting out, then you wait 2 years to do it, then it might be beyond control, right? It might hit the different stages. So how does virtual health improve the speed of which overall healthcare can operate and offer better treatment to people in a more efficient, speedy manner?
Yeah. So I like to answer this with a hypothetical kind of story, right? And so this is the kind of thing where it just makes more sense. It makes it a little bit more real. So this is actually a story that I kind of outlined a little bit on the website, and I'm going to kind of change a couple of details of it just because my memory is bad. But essentially, let's say you have a person, right? Let's say her name is Sarah, right? So Sarah, she just got released from the hospital. She just had gallbladder surgery. And so she knows that she needs to have a number of follow-up appointments. She needs to check in with some other doctors to make sure that everything went fine, right? And let's say she also has some other conditions. Maybe she's also elderly. Maybe she also has some other chronic conditions like, I don't know, let's say she's also diabetic. That's an easy one. So her health insurance company, being, thinking ahead, has assigned her a care manager, and her health insurance company is using Helios, our platform. And so now the care manager sees that she has gotten discharged, right? They see that information in their system immediately. She's gotten discharged. She's in the cab on the way home, right? This care manager already has that information without even acknowledging it or thinking about it or doing anything. This person's follow-up appointment has already been scheduled and been pre-approved, right? So the health insurance company doesn't need to send paperwork, do anything. They already know that they're going to pay for a follow-up appointment in 2 weeks. They already know that this person has a follow-up appointment with that person, with that doctor, with their doctor, surgeon, essentially. But then they also have a follow-up appointment with their general practitioner a week after that. And oh, by the way, she's taking a cab home, and she doesn't have any history of using any sort of like, for the health insurance company knows she's not a driver, right? She's a non-driver. Maybe she has an eyesight problem that they know for a fact she doesn't drive. Well, that means she's going to need to get there, right? So now, a couple hours later, they give her a phone call. The care manager just picks up the phone, calls her. Hey, we saw that you got discharged. How are you feeling? Blah, blah, blah. And then, will you need transportation to these sites, to these appointments? Sure, yeah, I definitely need transportation. My daughter-in-law is out of town as with my son, and I'm all alone. I just got back. I have to take a cab home. I have no way to get to the hospital otherwise to my appointments. Sure, right there from the platform. Type a few keys. She now has transportation scheduled through a local vendor. It could be connected through Lyft, it could be connected to Uber, or it could even be connected to a local cab company that does this, or even if maybe she has a wheelchair, a paratransit company that has the right type of car that her wheelchair can get put into. So now all of her appointments, all of her follow-ups, all of her things that normally could have been hindrances to getting better health and to being healthy afterwards as soon as possible, she now has eased the process. At most, the most time-sensitive part was making a phone call that took 30 seconds, maybe a few minutes, right? Let's look at the opposite angle, right? Where she doesn't have that. She doesn't have that care manager reaching out to her. She doesn't have the platform supporting her without her even realizing it. She takes her cab home. She realizes 2 weeks later, there's none of her friends are able to drive her to there. She looks in her wallet. She doesn't have that much cash to take her own cab back. So she postpones it. So she postpones her follow-up appointment. But the surgeon her general practitioner told her to see the surgeon first as a follow-up and then go see him. So she postpones that one too because she knows that one's going to be late, right? And now it's been a month. She hasn't had her follow-up. And now she starts feeling a sharp pain and she starts feeling really sick. So what does she do? She has to call the ambulance, right? She has to call 911. She calls the ambulance. Ambulance comes to her house. They take her back to the hospital. There was a complication that's happened that would have gotten caught had she just met her follow-up appointments, but she was unable to. This wasn't her fault. This wasn't her being negligent. This was a matter of she's a victim of the circumstances, right? And now she's in the ER. So not only is she suffering, now she's in pain, she's suffering, she's alone, as we established before. So she's having emotional trauma too from all that. And all of this could have been prevented. Now let's continue on, and who else suffers from this, right? So now the hospital has to bill for this, right? So the health insurance company, and the health insurance company is going to be like, well, why didn't you guys take a better care of her? Why did this complication happen? So now there's a conversation between the payers and the providers about why is this happening? Where did this come into? Now the health insurance company has a much bigger bill to pay because it's an emergency room visit, ambulance transportation. Now they're paying more, right? It's in their best interest to spend a care manager's 1 to 2 minutes to give her a phone call and take care of all of this than it is now to pay these thousands of dollars that this transportation had to take. And that's assuming, of course, obviously, that her prognosis is great, that they are able to take care of her at the hospital. God forbid something happens at the hospital and she gets worse. that situation only compounds exponentially as to how much more money it costs, how much worse she feels, how much more she has to go through. And now you think about that as one person, but we're talking about our platform serves over 8 million people. We're talking millions of times this situation over and over every single day. And this is the one of the kind of limitations of our current healthcare system. We have all of these different kinds of systems and all these kinds of different places and kind of information sources, but we don't have a connecting tissue. We don't have that connective tissue that brings it all together and makes it easy. You know, we have Amazon and we have Google that talks. Your Google, like my Google device, if I say the wrong phrase, she's going to light up in the other room, listen to me, ask me, and I can just tell her to go order me some food. So now my Google device is connected to my phone and to my Seamless app, and it's connected to my TV also. So I don't have to like get up to reach the TV remote. But why can't our healthcare work that way? Why do we have to live in a world where our healthcare is behind our entertainment? Like, priority says, right, that your healthcare is one of the most important things to you, you know, right behind your home and your food and your basic necessities.
I would imagine if you don't live, you can't enjoy everything else. So
Exactly.
it's an extreme case. I actually noticed, so which actually brings me to a very wonderful point that you brought up about logistics, ease of use, technology, because you actually used to be a dispatcher for an ambulance company, correct?
Yeah.
You used to be a volunteer EMT.
Yep.
And so bringing all that together, you understand and have seen firsthand the result of something going wrong, if I'm correct to say. So how important is your mission of proactive healthcare for all versus, if I'm mistaken, correct me, what seems to be reactive healthcare nowadays?
Yeah, it's a great point. And that's honestly the question we wish more people were asking, right? So personally, right, part of what drives me and part of what like encourages me at Virtual Health is that we look towards making healthcare proactive, as you mentioned, right? We look towards making healthcare something that acts before it needs to in order to prevent something going horribly wrong. And since I've had that history of being an EMT, of being someone who was a dispatcher, I've seen the emergency side of that. I've seen where it is at its worst. I've seen people at their worst. I've seen people in car accidents and people who have, you know, had their systems shut down. I've had people, their organ systems shut down. I've seen at the dispatch where I worked as a dispatcher, I also worked as a professional EMT there as well. We had to constantly do transports out of nursing homes or from assisted nursing facilities over to hospitals. Sometimes the ER, more often than not, is for appointments, transporting them back and forth, especially if someone has an oxygen tank and can't move on their own. All of these situations where everything could have been made easier. And you know, not to say that people's lives, when they're in these kind of serious conditions, it's because things were bad for them. You know, some people do wind up in those situations regardless of what services were available to them. That's the unfortunate human condition, right? But what I'm really driving at is some of them did experience that kind of like something was not there, something was missing from during their healthy years, quote unquote, or during their time where they could have been better. And if had healthcare had a little bit more of a role in being proactive rather than just reactive, everything would have been much better, and they would have lived a little bit better life. They would have had a better quality of life, at least for a little bit longer.
That's actually very interesting about that you bring that point, because like you said, we live in such an on-demand society. I need an Uber to get to your house in Brooklyn. I'll get an Uber at my door in 3 minutes. I'll get there. I want something from Amazon. I want to order Legos. I don't want to go to the store. I have a Batman thing coming in 2 days. So everything is such on hand nowadays, and through automation and technology. And one of the things that your platform talks about is automating, automated data feeds, pre-populated forms, pre-considered tasking, because there's a lot of administrative work, it seems. And if you're able to, in my understanding, reduce the time, the hassle, the financial, because people think money, reduce the financial cost of that, then you could shift the resources towards better care for the patient. Am I mistaken?
No, you're absolutely right. There is definitely an interesting kind of balance, I would say. You have all of this. Wow, I'm so sorry. I just lost my train of thought. My phone is going off and it's distracting me. Sorry, one second.
Perfectly fine. We're all human here. Ladies and gentlemen, my show is uncut and allows for unedited, true and no skewed information.
Sorry about that. I think it was a package or something at my door.
That's a good thing. See, it's automation. You get your
Yeah.
package comes through, you get a notice on your phone. You're sick, do some help, right? So anyway, back to the theme of automation, lower cost, shifting those resources to the patient.
Yeah. Can you repeat the question one more time? I need to get back into thinking.
Perfectly. So in virtual health, there's a segment that says automating and lowering the cost of operation administration, paperwork, pre-filling out the forms, and this way you're lowering the cost so you can use those resources, especially if they have a finite resource, and being able to shift from the excess to better patient care or making the system work better.
Yeah, absolutely. So now that my brain is back in working order, I can kind of touch on that a little bit. So yeah, health plans have to, so I mean, this is still thinking about in terms of doctors and health plans, right? I mean, a lot of them do use systems for a lot of things, but there's still a lot of pen and paper, right? And even when they're using platforms and they're using systems, right, technology to their advantage, there's still a lot of like manual entry, right? So let's take something really, really easy, right? You have to, on your like assignment, right? You're a care manager and you're getting assigned a set number of members, right? And you know that today you have to call 60 of them. One of them you see on your list, let's say John Doe, right? You need to call John Doe and you're going to try to do that, right? So you go ahead, and if you don't have a system that's automated, right? You don't have a system that makes things easy, you can't just click on John Doe and it'll just call him. You then have to go search his name in your system, and then you'll see his phone number.
It sounds annoying.
Then you have to turn to your right. You have to pick up the phone, an actual physical phone, dial his number, talk to him. Hopefully you get through to him, but maybe you don't, right? Now you have to go and look to see if in the notes there is another number to reach him by. Maybe there's another contact. Maybe he's at another place, another home. Maybe he is someone who unfortunately has no home, right? He has no definite home, and he's operating out of different like locations. And so there's information there on how to reach him in the event that you need to. Well, now you got to go hunt them down, hunt down that phone number. And it's not all at your fingertips, right? Yeah, that's fine. You've now spent maybe 10 minutes to make a phone call that should have taken 1-2 minutes. And okay, fine. You can talk about how 10 minutes waste is no big deal. But remember, you had 60 patients to call. You had 60 members that you had to call. If you had to,
those minutes add up over time, right?
Right.
Imagine.
You now lost about an hour's worth out of your day, let's say. And out of those 60, maybe you didn't even get to call all of them because you didn't have enough time in the day.
Wow.
You called 40 of them. You called 50 of them. Now, fine, maybe tomorrow you can be faster. Maybe you can work harder tomorrow. But at the end of the day, that's technical debt. That's administrative debt that's piling up that you now have to work harder to achieve. And to offset that, right? You can hire more managers. You can give less patients, give less members to each care manager. But at the end of the day, you can also just have a better system and take away those little wastes in time.
That's actually very, very important, because with the time waste, people don't realize how critical every second is sometimes.
Mm-hmm.
And I want to broaden out a bit into another segment that Virtual Health talks about, which I actually think about, which is the concept of proactive healthcare for the long term in terms of behavioral health, mental
Mhm.
health. And because people, when they think healthcare, they normally think catching a cold or diabetes or a physical illness that's impacting them, and always jump in whenever I'm misunderstanding. And then they're also forgetting that mental health is very important, because someone that's affected by it may not be able to function at their best,
Mhm.
or at worst, it might cause themselves harm, because more behavioral health, the individual is more at harm to themselves than they are to other people. In my understanding, that's the general overall statistic. Am I wrong? Or is that the understanding nowadays?
I mean, sometimes people can be more harm to themselves. I would say that oftentimes the one of the biggest challenges and biggest harms that a person could face is actually not having the right resources, honestly, because you're absolutely right. Mental health is a huge kind of area. Um, but aside from mental health, right, like I kind of touched on this a little earlier when I talked about social determinants of health.
Okay.
A person is more than just their medical diagnoses, right? They're more than just the congestive heart failure, the lung issues, the kidney issues, they're way more than that. And
Right.
your mental health is a huge part of who you are is also, right? Or rather not who you are, because obviously it's not part of your identity, but it is part of your experience as a human, right? You are experiencing these, whether or not it's positive mental health or negative mental health, you're still experiencing the human condition. And that comes along with a whole bunch of situations. Um, and so bringing in information from behavioral health specialists,
Mm-hmm.
bringing in information from, you know, addiction counseling services, bringing in information from transportation vendors who may bring you around, may help transport you from area to area. All of this is super useful in creating what we like to call a whole person picture, right? A whole person view. And you don't really get that if you're only looking at one place, right?
Mm.
The kind of like the old adage is, if all you have is a hammer, everything looks like a nail, right? So if all you're thinking of is, I am a doctor, I treat, let's say you're a cardiothoracic surgeon,
Mhm.
right? You do surgeries on the heart, you do surgeries in the chest, right? That is what you worry about. That is what you focus on. If someone comes to you and they are outside your specialty, they're outside your specialty. You can't do anything for them. You have to refer to them. You have to refer them to something else. And you're wondering, why did they come to you in the first place, right?
Mm. That's
That
actually.
that kind of grows out to a much bigger level, right? Let's say if you are a doctor, right? You've gone through medical school, great. You have your specialty. You might be general practitioner, but at the end of the day, you are not a jack of all trades, right? You do not have the 100% total view of this patient. You have to bring in behavioral health. You have to bring in possibly social work. You have to bring in possibly all of these other areas in order for your view of the patient to be 100% truly valid and full, right? You can make your best diagnosis on them. You can give your best recommendation, your best treatments. But at the end of the day, if you don't have a full picture, you're limited in how much you can actually impact, because we have to go back to that 80% thing, right? As a doctor, you have gone through so much training and so much learning, and you're still only able to impact 20% of that person's health, right?
Mm.
If they have a major gap in that 80%, you can help them only up until that point. And then past that, you're going to have a lot of difficulty seeing results in that person. What if the person just doesn't comply with their medications that you've prescribed them, and they're just not complying? And the reason they're not complying is maybe they can't afford the medications. Maybe they don't actually have health insurance. Maybe they're paying for stuff out of pocket, and sometimes they just have to decide this month they don't get medication. Or
That's actually a very tragic story it brings me to another tragic story of the individual that, because they lost their health insurance, they had to ration their insulin. And
Mhm.
because they had to ration their insulin, they went into diabetic shock and died.
Yep.
Or let's use a less extreme example of, like the dentist. If
Mhm.
all you're doing, you're never brushing your teeth, you're never flossing, you're always eating candy and there's nothing but sugar. You go there, it's like, oh, why do all my teeth have cavities? Well, why did they all fall out? So I guess your overall message is it's very important to have that other fundamental aspect of healthcare, which is understanding the root of the issue and also a sense of self-treatment. Is that correct?
It's absolutely correct. But then
Self-treatment?
you also have to think behavioral health, right? So because we mentioned it before,
Right.
when you think of behavioral health, you think of things like mental health, right? You think of things like people with anxiety or depression, right? These are commonly understood ones, right? But the one that the groups of people who kind of get omitted from that, from most people, I'm not going to say everyone, but most people's kind of general perception of that is, what about people who are not able to care for themselves? People with intellectual disabilities, or
Mm.
people with who may have maybe they are able to care for themselves, but they're not able to really work. Maybe they're not able to kind of perform at the same level as you and I, right?
Right.
And these are people who maybe not are able to take care of their own medical needs, right?
Mm.
They might not be able to. And if they're not able to, who is there to help them achieve that, right? How do we know that they're not able to do that? If they
That's
are able to go
very
to the
interesting.
doctor,
Yeah.
they're to make it to the doctor's office, the doctor's assumption, unless proven otherwise, is, hey, they made it to me, they can take their meds, they can handle themselves. Now, unless they're trained to look for signs in this person, and that maybe when that person gets home, they can't physically lift their leg to get into the shower and they have a bathtub, so they can't do that. Or maybe they get exhausted or out of breath very quickly because they're on oxygen, and their home has 2 flights of stairs to get to their top, to get to their bedroom. So they don't go to their bedroom because it's too difficult, and so they sleep downstairs, and maybe downstairs there's not enough heat, so now they're suffering from cold. And all of these little issues that can exist in people's homes. And we're not even discussing, we're not discussing third world countries. We're not discussing countries that have large amounts of impoverished people. I mean, actually, unfortunately, we are describing a country with large amounts of impoverished people, and we're talking about our country. We're talking about the United States of America. There's large amounts of people who fall into these categories. We're one of the few countries in the world that actually has both an obesity problem and a food shortage problem. It's a unique problem for a country to have. We have that amongst all of our population.
That's actually very interesting because a lot of times when people see, like you brought in the example of the doctor, he sees you, you
Mhm.
got to him, life is great. And there's a lot of misunderstanding that what you see on the surface does not give you the complete picture. And sometimes human beings have a tendency to miss it because they might be in an environment where they're surrounded by people that operate a certain way, think a certain way, it's what they know. So they don't have that extension to understand that, hey, there are other people that are lacking basic necessities, basic needs. Like, for example, I don't have sickle cell anemia, but someone else might. I don't know what that's like, but someone else might have it, and I can't see that. So they might be suffering from it. So there's another one that your company actually talks about, which is telehealth,
Mhm.
which is to my understanding, reading it, and it's a very skimming very loosely. It's basically like being able to give doctors like a bigger picture that they wouldn't see like a surface. Is that correct or?
Kind of. So our telehealth module came out kind of, we've released it actually right around COVID. And we have a different approach to telehealth than most people. So I'll give kind of like what most people think of telehealth, and then I'll talk about the way we look at telehealth. So most people think of telehealth as a platform or as a sort of like an app or something. Essentially think FaceTime with your doctor, right? That's what telehealth is to most people. It's a little bit more than that, right? It's a communication, right, between you and your doctor that happens without you being physically in their office. That can be through text communication, through email communication, through some sort of secure messaging site, hopefully, so that HIPAA laws are protected. That's what's usually entailed. But normally, and more often than not, it's between a provider and a patient. We looked at that from the other perspective, right? Because and everyone kind of doesn't really think about them, but health insurance companies, right? The payers they also interact with members. They also interact with patients. They may not do it in the capacity of treating their illnesses, right? That's the doctor's job. That's the nurse's job. But they do it in the perspective of communicating with this member to make sure that all of their needs are being met and to see where they can step in to assist in the capacity that the healthcare professionals that they're used to seeing can't quite do anything about. So what we did was we created a module to our platform where health insurance companies can easily just have the same way on your phone where you have your contacts, and next to one of your contacts, you have a little camera icon. You tap on that and it calls who you're looking at. It's a video call and you chat with your friend, and probably the same way we're in a Zoom call right now.
Right.
We gave that capability, that functionality to care managers, because especially right after COVID's numbers started going crazy, these care managers, they were no longer able, one, legally, and two, morally and ethically, were they able to go to people's homes to go visit them and to go see what their conditions were like. Because we come back to the situation of, you don't know what their home life is like, right? You don't know, they may tell you everything's fine, but they may also be someone who walks around with an oxygen tank, who has to climb upstairs to go to bed, and that's a minor problem, right? That's easily fixed. Maybe they just need an elevator on their stairs installed. It's a simple solution, right? But it's an expensive solution in that particular situation, but it's a simple one, right? There's an easy answer. We install this, your problem goes away. You now have a solution to this problem. But if no one goes and visits, and the person on the member themselves is unaware that this is something a health insurance company might be able to do for them, there's a disconnect, right? So, but if you are on a video chat with this person and you see them on oxygen, you can be like, hey, it prompts you to think, do you have stairs in your home? Oh, you do. Do you have difficulty climbing those stairs? Okay, let's see what we can do about that, And then boom, you now have a dialogue. You now have the health insurance plan doing its best to assist this person, and you have a better outcome. That might not be a situation that's too common, especially because a lot of people who use, especially our platform, we specialize with Medicaid and Medicare individuals, and something like an elevator for the stairs is kind of a big cost item that many health insurance companies might not be able to pay for, but they would do other things in order to facilitate this, or they might be able to find someone who can go to the person's home and help them adjust to this situation. There's a whole bunch of situations that they can help with, but they need to know about the problem.
That's actually very interesting, because the other concept that virtual health brings is population health management solutions. And with COVID, going back on another topic, we realized that, if one person's sick, the population is sick, right? Because it transfers one person to the next. So it's very important to have a population, like an overall public health management solution. Is that correct?
Yeah. So for this one, we also approach it in a couple of different ways, right? So thinking about COVID, one of the things that we helped introduce was, and in terms of population health, right, was person tracking or patient tracking, right? So we partnered with another organization who actually had a team of people standing by at call centers, and they were actually remote employees themselves, where if we find out that a member of a certain health plan may have come in contact with COVID or may have contracted COVID, our partner company would reach out to them, and then using our platform, they would be able to log that this person has COVID or may have COVID or potentially came in contact with COVID. And then they trace it back for, I think it's about 2 weeks, I think was when it first came out, I think how long we were tracing it back. And just tracing back all of the locations they went to in those 2 weeks. And then also all of the people they may have interacted with, right? Because this person doesn't want to call up his friend. Maybe he saw his friend, and even though he was on lockdown, he shouldn't have. Maybe he did. Maybe he wanted to go see his friend. He doesn't want to tell his friend now, hey, you might now have COVID because I don't know where I got it from, right? And that's not necessarily we can argue the morality or the ethics of it if it's his responsibility, but it isn't his health obligation to do. Right. His obligation now is to make sure that he is safe because he potentially has a life-threatening disease.
Correct.
So now this organization that we partnered with would reach out would contact that friend. And then maybe that friend also now has some other people that they talk to. So they would call all those people and all the locations that they attended or that they visited and keep track of all of that, and then continue to call them as follow-ups later to see if any of them turned into anything. Because if they did, they have to go back further and continue to see where else could this have spread. It's a very granular approach to population health. Normally, when you think of population health, you think of a much larger scale kind of thing, right? So you think of what are the diabetes trends in Southern Chicago, right? Just as an example. Not that we looked at this, I'm just saying this is
right.
When you could think about it. And you think of it in terms of what impact does the New York City subway system have on the health population of us, right? So we have hospitals spread out through New York City. Does the subway system enable or disable people from getting to these hospitals? These are the kind of like weird statistics and weird things you can kind of pull out of population health.
Okay.
And you can start seeing trends in them using some data science in order to kind of like determine weird things, right? So one example I can kind of talk to that came out of our platform, I'm actually not sure how much I'm able to speak of publicly, so I'm not going to name the customer, nor am I going to name their.
Let's stay away from anything that's considered potentially trade secret, confidential.
Yeah.
So back.
Oh.
Yeah. So back to this one actually thing that was actually on my mind that was interesting is that you actually have a double major in biology and psychology.
Yep.
So you know very well how hand in hand that goes when it comes to patient care. And one of the important things that you said with your friend is that maybe they're too shy, or maybe they're embarrassed, or they're like, oh, I just gave my friend COVID, so on and so forth. How much does fear, embarrassment, and so on and so forth prevent people from making decisions that positively affect their health, the health of others? How is technology going to make it easier to sort of get past that in a way that doesn't make them feel embarrassed or ashamed or?
Yeah. So not quite my specialty, not quite virtual health specialty,
Okay.
but I can talk about it a little bit. So you're absolutely right. Kind of what you're leaning towards is that people have a kind of almost a fear or kind of a phobia of like being the cause of kind of pain or being the cause of suffering or even discussing it or discovering it about themselves, right? And
right.
So I have seen some studies and some kind of research that says or suggests rather that there is a barrier to getting care for themselves or even informing others. I do know that something like contact tracing, for example, when we think about it for COVID, we also know that it kind of came from other places, right? So one of the interesting things is when someone is diagnosed with something like HIV or AIDS or certain sexually transmitted diseases, not all, but some, there is an effort on there's a concentrated effort on the part of the hospitals or on part of their providers to reach out to previous sexual partners and inform them that they inform those people that they should be tested for those kind of diseases. And that kind of comes out of the idea that, and I may be incorrect on to what diseases it is, because again, I'm not an expert on this, so take that with a grain of salt. But that's my little legal disclaimer. That kind of approach, that's the kind of thing no one wants to go to a previous sexual partner and tell them about a potential diagnosis, right? Even if they got it after they were with that person, they don't know that. They might not know that, right? So they don't want to be able to tell that. And then they also might just be fearful of going and getting treated themselves, right? So there's the mental health component of it, of they have anxiety. They're also ashamed and they're embarrassed. And so that might prevent them from getting the care they need. Now, technology and its role in that is it facilitates the information to pass along. I wouldn't say that there's currently at least an easy solution for technology to help that individual get the care they need and face that emotional barrier, because at the end of the day, it may be easier for that person to interact virtually instead of, or maybe anonymously through maybe like a BetterHelp app or something like that. However, there is a certain amount of information that still has to get passed along. They're still being identified as a patient, and their name and last name are being recorded. So their own anxiety may or may not be treated or covered by that situation. So I don't know how that is currently being affected, but I would assume that there's some genius in Silicon Valley probably working on that problem right now.
That's actually, so in the future, how important do you think it is to have value-based care in like one ecosystem or one umbrella or one system that people can go to that will basically, instead of like I think of like an Apple computer. If something goes wrong with my iPhone, I go to the Apple store. My MacBook, I go to the Apple store. How important is it to have a comprehensive system or something easy for people to use?
Sure. So you brought up two different kind of ideas there. So you mentioned value-based care, which I feel like is a totally other question. I can kind of touch on that, but let's come back to that one. You're talking about the ecosystem and kind of like bringing everything into one place. And to me, this kind of relates back to social determinants and their importance. It comes back to all of the different data sources that a person creates and kind of experiences, right? So they go to a doctor, there's their electronic health record. There's also the claims data that the doctor then sends to the insurance company. There is the insurance company's files and what they create. There's the authorization file that gets created. So it's how much they're agreeing to pay for that service. All of this data kind of starts being created. And that's just around one interaction, right? If you have hundreds of interactions, you're creating millions of little bits of data, right? And all of that needs a place to live and all needs a place to go. And it needs to be related back to one person, right? It doesn't help you if your insurance company knows you by John Doe and your doctor knows you by John W. Doe. Like, those two might as well be completely different people at that point if there's no way to connect them, if there's no way to bring them into one place. And something like that sounds really silly, but it happens. One of the tasks upon when a new customer kind of purchases our software and they send us their data, one of the things we do, part of it at least, is deduplication. We're looking for people who might be the same person. And then we're like, hey, these 1,000 people might be the same as these 1,000 people. Can you verify? And then they have to go through and be like, oh, actually, these two are the same. They have two different names. Oh, this is a woman who changed her last name, and like, sometimes it's benign and it doesn't really matter. And sometimes in the rare, like little tiny % of cases, sometimes they are actually duplicates, right? And that's usually created because of data coming in and it not being properly parsed and properly put into the right place. So it's really, 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 really important for everything to kind of come into one main ecosystem, one main hub. And that's what our platform is. It is that hub that all of that data can flow into so that when it flows back out, it makes sense.
That's actually a very good point, because like when I was doing my tests, they used my middle name as my first name. And then I was like, well, that's not me. It's like, have you been here before? Yes, but no. I'm like, no, they're like, I feel like it's a lot of small, silly things that can be fixed relatively easily with a little oversight, like a small adjustment, nothing crazy. So the final question I do have for you is, how optimistic are you on the future of healthcare technology, and what new things are you really excited for?
Yeah, so I'm extremely optimistic about the future of healthcare technology. I think that companies have started moving in the right direction, and I think they've started, especially COVID has shown them that they have room to improve. I think what happens with a lot in healthcare especially is things work, right? Patients do better. Patients are not dying in large numbers. They're doing better on average. So the assumption is everything we're doing is correct and fine. And so until you have a major reason to improve and to kind of like rehaul the system, you don't want to introduce kind of like new variables that might screw up your success, right? Because you screwing up your success turns into patients suffering. And you never want that. No healthcare organizations don't want that. Doctors don't want that. The government doesn't want that. the individuals don't want that, right? So I think that COVID has shown that there's a lot of room for improvement, because the little problems, not the little problems, I'm making light, I don't want to make light of such a pandemic, of such a huge deal, but the problems that have arrived and have kind of like reared their ugly head have always been there, right? Like COVID hasn't created problems. COVID didn't suddenly make the healthcare system bad or anything like that. The healthcare system has slowly been being overwhelmed with numbers, with not enough doctors, with not enough nurses, with not enough, especially in primary care. And that compounds. And the more time that passes, the more, the worse the little problems get. And our healthcare system, you know, us being the great country that we are, we're pretty good about making do with what we have, right? Hospitals in New York, they're constantly they're understaffed, and they're constantly over budget, and they're constantly needing more money. And yet they manage to take care of us, of one of the most populous cities in the world, you know, in the country. You know, it's a miracle that, and this is a testament to our heroes. You know, this is a testament to the healthcare workers who are day in and day out making do with what they have and just making it happen. You know, they've got one ventilator, 20 patients. Okay, let's figure this out. Like, how are we going to do this? And healthcare and insurance companies are kind of doing the same thing. Like, yes, a lot of them make a lot of money, but people don't realize that you still have at the high level, sure, maybe the high level executives are earning tons and tons of money. If you want to really get into the economics of health insurance, you can. I don't want to get into that, because to me, that's not relevant. To me, what happens is they are still treating patients. They're still making member lives better. They're still, even at their highest levels, you see, like, I just had a webinar that my company ran, and we spoke to UPMC. They're in Pennsylvania, and they're one of the biggest research medical facilities, and they also have a health insurance plan connected to that. And they're on the cutting edge. They're constantly experimenting. They've realized that there is a need, an absolute need for healthcare to move forward and to be just better, right? It needs to be like technology. It needs to be like thinking ahead. And so that's what this organization, I admire UPMC so much. I can name them because this is just public information. They're forefront of researchers. And even when it comes to the webinar we had was about behavioral health and integrating it with mental health. I'm sorry, integrating behavioral health with your medical practice, with your medical care teams. And what does that look like? What does it mean to have one care team that has mental health professionals on it as well as doctors on it? You know, you're now, and literally this is what we've always been talking about, the whole person picture, the whole person view. You get that when you have teams. You understand that one doctor is only able to learn and to be a specialist in so much. You can't physically expect one doctor to be a master of everything. So what do? You give them a team. You give them a group of people who also are specialists in their own fields, and you put them in charge of populations that have multiple problems, right? You have a group of people in let's say in Pennsylvania, who may have, there may be a huge population of people who have intellectual disability, right? But that doesn't mean that they don't also have congestive heart failure or diabetes, or maybe they have renal issues. You know, these are all of these multifaceted kind of things that they need to be treated. They need to be approached. And great organizations like UPMC are doing their best to treat them, to take care of them, keep them in their system. And that's how they're succeeding. They're looking at it. They're taking a step back and looking at this person and going, okay, this person has 10 things that we can make an impact on currently, but they have 20 identifiable factors that have affected their health negatively. How do we go from 10 to 20? And instead of thinking of it of how do we make our doctors do more, or how do we make our care managers do more, it's how do we do more for this person? It doesn't matter who is involved. It doesn't matter what resources are involved, because at the end of the day, a healthier person is a less expensive patient, is a less expensive member. A healthier member is a happier member. A happier member is someone who lives longer and who can thrive in society and be a bigger part of society for longer. And isn't that what healthcare is all about?
that's actually interesting because people go into healthcare because, you know, it's the business of making sure the human species, if I'm wrong,
Mhm.
is healthy, stays alive, and can be a part of it because we're all human beings. We have like, I would imagine people overall have an innate sense of caring for one another and making sure that we don't die.
Yep.
In terms of like a very generalized way. So I definitely want to thank you for being on our show. I want to
Sure.
thank the audience for tuning in, and I look forward to speaking with you the next time when this whole stuff is over and delving further. So again,
Yeah.
Kristian Romero, pleasure to have you.
Thank you. Wonderful being here.